Okay, so we are going to explore the endocrine system and fool around with this. Um, and I'm going to drink a morning cup of coffee while I'm doing this. So cheers. And the birds are tweeting. So I think that doing these recordings there's a big possibility that it's causation and not correlation, but we'll see. All right, get my hair all fixed. Okay, this is the last chapter in Unit 2 of Essentials of Therapeutic Massage, Essential Sciences. And we are going to talk about the endocrine system. So let's share the screen, get to our electronic version of the textbook, open it. And this is where we finished off, was on the peripheral nervous system. And so we want chapter 6. So we're going to use our little sidebar here and hit systems of control and hit chapter 6. And then we're going to go to it. Isn't this electronic version so good? Okay, this is the endocrine system. And the endocrine system can operate a little bit independently, but mostly it's in sequence, sometimes called an axis. It's in sequence with other endocrine functions and the nervous system. And a lot of that happens through the hypothalamus. And the pituitary is a big overarching control gland. It secretes a lot of hormones related to the endocrine system. So loop on communication networks. So this is pretty, I mean, you need to know what each of the endocrine glands are and what they do, and then their relationship to other fairly direct relationship to other endocrine glands. And the major hormones that are secreted. The pathology is pretty basic here. It's too much hormone or not enough hormone. And the secretion of not enough or secretion of too much sometimes can be due to some sort of tumor activity on the endocrine gland. They have names. Each of the pathological conditions does have a name, but the bottom line with it is either too much of this stuff or not enough of stuff being the hormones. There's also sometimes a disruption in the interaction between hormones. So they are not communicating in these combined functional axes. And so this chapter, while complicated in terms of some language here, it's a little easier to comprehend than the central nervous system and the peripheral nervous system. There aren't as many small parts, if you want to look at it that way. And we also have to realize that not just the traditional endocrine glands, but many other organs secrete a hormone-like substance. And so we need to take a look at that. And we also have to think about the gut bionome, all the bacteria and critters that are living in there, and what their influence is on hormones, because they secrete hormones as well as neurotransmitters, because they're communicating with this system of control. So communication. This is telling that to do this in order for that to happen. And it can get messed up in the translation. So as always, we look at our objectives and work on our key terms. Now, the actual names of the hormones are not listed here. Morning coffee stimulates the endocrine system and the nervous system. You'll have to superimpose all the names of the hormones on that. So our learning how to learn, it's just repetition. And so to support that, the YouTube videos that I have selected for you provide that repetition. And remember, on the sidebar, once you open one of those up on the sidebar, there are others. So if you feel like you need more repetition, click on some of the others and just continue to hear the same information over and over and over in a novel and different way. So as we look at this as an overarching theme, we are looking at the endocrine system involved in reproduction, growth, and development, as well as regulation of metabolism, regulation of chemicals. We're such a chemical soup, and a regulation of transport and movement of these chemicals. So there is a little bit of a separation between the nervous system and the endocrine system. The nervous system is typically very fast acting. So a reflex response is very fast. And there certainly are times when we need a more sustained response. And then that's where the nervous system relies on the endocrine system to create a longer term response to this. So we talked about the sympathetic autonomic nervous system and the fight or flight, and the parasympathetic rest and restore, and then the enteric. Those functions, those autonomic functions, are very much regulated, organized, and orchestrated by a cooperation between the nervous system and the endocrine system. Okay, so here are our reading blocks, our reading study segments, overview of the endocrine glands and tissues. So it's going to ask you to look at the physiological processes. First recall that we have to understand normal function before we can use massage applications to mimic normal or support normal. And if we don't understand normal, then we can't understand a deviation or a movement from normal, which is our pathology. So whether we're working within a pathological construct, or we're working within supporting well-being and health, we still have to know normal in order to mimic normal, because a return to health, even in a pathological condition, is about returning to normal. So we're going to explain some of the different endocrine glands and the function in the body. We're going to look at endocrine versus exocrine. Exocrine glands secrete onto the skin or out of the body, whereas endocrine glands secrete into the bloodstream. So Here's an activity, and remember that an activity is about reinforcing new information by connecting it to already stored long-term memory. Do these. They don't have to be pretty, but the act of picking up a pen or a pencil and writing in here, and you have the paper version of the book, right in the book, and that will help solidify each chunk of information. So always stop and consider information and conversation within the mentoring tips. See if you agree or disagree. Look to see if there's information that in these mentoring tips that new information has emerged and that would influence the thought process here. So we always want to look at the content we're learning through the lens of massage therapy, and these mentoring tips and focus on professionalism help do that. All right, here they are. Most people enjoy this chapter because they can connect it with behavior, just like a lot of people have a better understanding of the autonomic nervous system because they can hang it on sympathetic and parasympathetic. So there's not as many structural parts to this, and I think that makes it a little easier to understand as well. So the overarching structure that provides the interface between the central nervous system and the endocrine glands is the hypothalamus. And I think it's very interesting to kind of get an understanding of the feedback loop. That's what this is right here. The feedback loop, the circle of information that has to happen in order for us to have this internal regulation and the important role that the hypothalamus plays in that. So absorb this. Here's a table that kind of gives you an idea of the hormones produced by the hypothalamus, and lots of times what you're going to find is that the hypothalamus sends a chemical communication to the pituitary, and then the pituitary sends a chemical message to an individual gland. So, but do process the importance of the hypothalamus in all of this, because it really is the bridge between the nervous system and the endocrine system. So here's one of those axes. This is a common one, the hypothalamic pituitary adrenal. So that they communicate together a lot. And once you get something going in part of this axis, this is a triangle here, then it's going to travel around in that as a messenger. And what's interesting about this is this particular communication network was one of the ones that was identified by Dr. Hans Selye, who was studying how do we adapt to stress and the general adaptation syndrome, which remains pretty accurate even to this day on how we respond. Nothing is as clear cut as a flow chart, but it does give us an idea of how things tend to interact with other things. So here's our little segment. There's a lot to think about here. It's not a lot of pages and not a lot of words, but a lot to think about. So here is the general adaptation syndrome. So make sure that you Really pay attention to that, because it's a good way to think about how we are going to create a goal structure and a treatment / care plan for our client. Okay. So here's a practical application. And this is talking about complementary and integrative health. And lots of study going on in that realm right now. And massage has an important part to play as a support mechanism for health and well-being, and that clients can seek out on their own, as well as supportive care massage therapists as supportive care as part of an interdisciplinary team, offering the uniquenesses of touch that we do. And because of the feel-good aspect of massage, that in and of itself, that happens through the nervous system and through the endocrine system, there's a lot of value in helping people move through or adapt to stressors. And then we also talk about other endocrine tissues, which I mentioned. So all of these different tissues, we thought, like the heart tissues and some of that, we thought, oh, it just does this, but it doesn't. It has its own communication chemicals that function like hormones. And because they are in the chemical soup, then they influence and affect the overarching goal that regulation is trying to achieve. So here's one. There's been a lot of study because obesity is a real problem along with diabetes in our society now. And they're starting to unravel that just a little bit more. And they understand now that adipose tissue is a quite powerful endocrine tissue. And some of the secretions are self-sustaining on that. It ties into a survival response. So it seems as if our body holds on to fat for dear life. And biologically, that's kind of is what it is. But too much of a good thing, because fat tissue, adipose tissue, is a good thing. It has a lot of value. But too much of a good thing becomes a bad thing. And that's what happens. And then you get this tendency to diabetes, which is just devastating, but can be controlled. But one of the most common endocrine-based pathologies that you will encounter. So here are some of the other endocrine tissues, and it's pretty fascinating as we have better and better equipment to see smaller and smaller structures in the body, how we're starting to realize that things are not as clear-cut as we thought, and there's a lot more going on than we can even imagine. Now these endocrinish functions have been observable for a long, long time. And many ancient healing traditions were based on observable phenomena, but that they couldn't actually see with the eye. They couldn't actually see what was going on. We have microscopes and all kinds of stuff to see things now. That they had to create an understanding around that, and that's where a lot of the languaging comes from in many ancient healing traditions. And it always amazes me how kind of accurate they really were as they were trying to formulate this. And in this textbook, we're presenting this as a way of understanding overlapping traditions and the language that goes with that. So one of the ancient healing traditions that is really resonates with the endocrine system is Ayurveda, as well as the structure function concept of yin and yang. So you might want to take a look at these, not as that this is a fact, but it's been an observable kind of an experience for many, many years. And we have massage therapy over the years has had quite a history, historical overlap with Ayurveda. So, you know, just as a general awareness. So here we're getting into the individual hormones now and what a hormone is. And they don't, you know, they don't really know how a hormone works yet. They think it's a hypothesis. Doing this in the morning. It's a hypothesis that there's like little slots that various hormones can fit in shape-wise on a cell, and then that triggers a response by the cell. They're still trying to figure that out, but it's a working hypothesis now. Maybe we'll find out that it's different in the future, but it's solid enough, it's plausible enough that we can go with that right now. So here are the various categories of hormones based on what they're made out of. And you're not going to be tested on the MBLEX to this extent, but it's kind of nice to have an overarching idea of the different families of hormones. So that's what this chart is. And then we're going to talk specifically about the pituitary gland. So it is the one that sends out hormones that tell other endocrine tissues what to do. So certainly, if there's something that goes awry, here's a practical application. If something goes awry in the pituitary function, then that's going to have a lot of effect downstream. So the pituitary gland is divided into two parts, anterior and posterior. And one of the ones, interestingly, through a series of events that massage can kind of affect is growth hormone. Not directly, but through promoting restorative sleep, because that's where growth hormone is most active. And of course, when we are actually growing, then growth hormone is very much involved. But what happens when we stop growing? Well, growth hormone is what supports tissue repair. And so it's part of the healing process. So it's what we can do is help a person sleep. Thyroid stimulating hormone. The thyroid is the great overarching endocrine gland related to metabolism and many, many other things. And then the one that has to do with the adrenal glands. Of course, pregnancy is a huge hormonal event. Follicle stimulating hormone, luteinizing hormone, prolactin. These are often involved in the reproductive cycle. And then melanostimulating hormone. Now, here's our posterior pituitary hormones. They act kind of on their own. And oxytocin has gotten a lot of study in relationship to touch. And so because of that, then to massage and what happens with oxytocin and how it fits in with trust and connection. So here's a picture about all the different hormones and kind of a visual on what they do. And then we get into our thyroid gland and our parathyroids and our pancreas. Now the pancreas, the endocrine portion of the pancreas is where the dysfunction can occur related to diabetes. So we've got insulin and glucagon here. Then we have our adrenal glands. These are the hormones from here are what are helping us manage stress. So they become involved in the general adaptation syndrome. Sometimes people will say, you'll hear people say, well, I have exhausted adrenal glands. Well, that just means overall that they're just kind of exhausted probably. And unable to deal with stress. And because of that, the adrenal glands may be involved. Cortisol is one of the hormones that is released by the adrenal glands. And if we don't have the right amount of that, the stress response will be interfered with and our ability to respond and adapt. Too much of this, though, or for a sustained period of time, like in chronic stress, has a lot of side effects. And so just like when you're taking cortisol, so that, see, the scientific community has actually been able to manufacture and or concentrate a lot of these hormones. So if we are not able to produce enough of them or we need an extra boost, we can take this as a medication. So this is used a lot for inflammation and autoimmune conditions, and we talked about that in previous chapters. So it's supposed to be fairly short acting, but when it's in the system for a long time, then we start to see the too much of a good thing for too long becomes a bad thing. So here's a little practical application. Now, gonad means reproductive. So here we go with our testes and ovaries. And the hormones that are produced there don't just affect reproduction, they have whole body effects. So slow down and pay attention. Then we have the pineal or pineal gland and the thymus. Both of these, especially the pineal gland, has had a connection to some of the ancient healing disciplines. It's located here in the brain. It has a lot to do with rhythms and cycles. It's kind of a cool one. They're all cool. Then here we have our other tissue hormones and an explanation here of the gut and gastrointestinal hormones, which science is really starting to appreciate, although many have wondered about this for a long time ago, about the importance of gastrointestinal health. So we're going to review what we have learned here. This is another type of repetition. Then we're going to get into the idea of pathology here, and I already gave you a little window on that. Hypersecretion, hyposecretion. And with hyposecretion, not enough, because these particular hormones have been able to be isolated into medication. While not perfect, it's better than not having any of it at all. I take thyroid medication, and I am thankful that that's available to me. If there's a hypersecretion, they need to also know what is causing that. And sometimes it can be a growth. Sometimes it can be a regulation issue out of the pituitary. We also have to stop and think about things within our environment that may be interacting with endocrine function. Some of the chemicals that are in our environment either mimic certain type of hormone functions, or they interfere with the communication on that. You might want to look this up outside of this textbook and learn a little bit more about it. I think it's, personally, my opinion, I think it's almost impossible in the way our society, we've treated our environment, to avoid some of these disruptors. But if we understand better, maybe we can do better on not polluting our environment. This talks about how these medications, particularly with the steroids, have been used to treat a variety of conditions, especially a lot of autoimmune conditions. Okay, so here are the specific names. Those are our pituitary, thyroid. This is a pretty graphic visualization here of thyroid hypofunction and hyperfunction. That'll get it into your brain. And then our indications and contraindications. And for this, one of the things that I have noticed in my career is a lot of both borderline hypo and hyperthyroidism is experienced as kind of musculoskeletal anxiety, fatigue, depression-ish symptoms, and can be a reason why somebody would seek out therapeutic massage. And I just want to caution you about assuming that it is in the realm that massage therapy can effectively work with. And we don't want to delay that. That's one of the concerns, is that I think massage can help people feel better for a little while, which will delay their seeking out a more thorough diagnosis and effective treatment. And the thyroid is one of those ones I see a lot. So you want to make sure that a person has had you want to recommend strongly that people have a good physical every year at least with their general practitioner, and that they have some blood work that does a check on this. Parathyroids are little, it's like para-professionals, a smaller professional. They are in the thyroid, and there can be dysfunction related to that. Again, with our indications and contraindications for massage. So this table goes through all of the thyroid functions. Here's our little activity, and then we get into the pancreas. Same thing, hyper, hypo. Lifestyle is a big player here. Indications and contraindications. So this is where diabetes lives. It is, again, something that you certainly will encounter because it is so common. And then here's your little reinforcing activity. And this is for, this gives you an idea in a visual form how system-wide diabetes is. And then we have our adrenal glands, the pineal, and most of these, if you look here at this one, indications and contraindications, relaxation methods, including therapeutic massage, are pretty good research here, do support sleep patterns. And a lot of this is related to the ability to have restorative sleep. So, you know, I'm confident in saying that regular massage will help you sleep better. And if you sleep better, your body will work better, and then you will feel better. So I don't have a problem saying that. Review what you have learned. Then here's our summary. Some suggestions for additional study going out onto the web. And then here's our little critical thinking scenario. And these are really helpful in looking at how we are going to really become extraordinary massage therapists, because we're able to adapt and respond based on the individual client's condition. And remember, the author's response is on Canvas for you, for if you're a HEC student. If you're looking at these, it's on the, and you're not an HEC student, it's on the Evolve site under Content Updates. And then all of our questions. And by now you might be getting kind of tired of this. But it really does reinforce the language and then helps you use that language in context. And that's what's going to help you with the NBLEX exam. So, and then writing your own questions and quizzing each other is a real good thing. So this completes Essential Science Unit 2. Now, where Unit 3 has to do with muscles, or let's start at the beginning, has to do with bones, joints, muscles. So those 3 chapters are about the parts, and so that you can understand the function. And then that's all put together so that you can really take the parts and appreciate the function, especially to support assessment and then treatment plan developing for massage with Chapter 10. Chapter 10 is the key that pulls all of the previous chapters together related to muscle or bones, joints, and muscles. So this upcoming unit, we'll slow down and we'll take some time with it because it's important to know, and it's tested on the NBLEX exam. So we have to really take time to look at the language there for that. So, bye.